It is our Zip Trip Flashback. It's a wonderful destination that we love. And each and every week, you know, on a Friday, we like to highlight a hometown hero from the area. We didn't have to look very far this week. Dr. Chris Heaton, he is the medical director of the hospitalist program at Prince William Medical Center. And the good doctor joins us live this morning. Hello, sir. So glad you're with us.
Yeah, good morning, Holly. Thanks for having me.
Oh, it is our pleasure. Tell me, what is a hospitalist program? I'm not sure I know what that is.
Yeah, fantastic. Great first question. A hospitalist is an inpatient physician who operates in the hospital only. We take patients from the emergency room upstairs to their care, take care of their diagnosis, work through their plan of care, and then ultimately discharge them. And so it's the family doctor that used to come into the hospital to take care of people has been replaced by what's called a hospitalist. And so that's what I am. I'm the hospitalist program director. And so my job is to sort of champion all of the folks that I work with to give them the tools to do all that work.
Well, you are the director, but you have, at least from what we hear, have definitely been on the front lines during this very difficult time. Talk to me a little bit about your experience, especially back in April, the height of it for you all down there.
Yeah, COVID-19 has just been a phenomenal experience for so many people. Tragic, obviously, for so many families, and we don't want to ignore that. But it's been a wonderful opportunity here at Novant UVA Health to bring our community together, not only in the hospital, but outside the hospital. We were hit very hard, as probably many of your viewers know. Statewide, we were quite impressive in terms of even the nation, the number of cases per capita relative to COVID-19. Treating these patients obviously brings about many feelings, things that I'll remember and keep with me the rest of my life relative to the things that we've seen and our team has seen. It's been an amazing experience that we don't hope to duplicate, but we're ready to do it if we are called upon to do it again.
What I understand is that you volunteered actually to be the attending doctor so that other doctors and nurses could actually limit their time, and you would go in there and you provide a consistency and a familiarity, not only for the patient, but for those families that couldn't be with their patients. Why did you feel like that was so important?
Yeah, the team got together early on in the planning back in January and February. We knew we were going to get hit, but we just didn't know how hard we were going to get hit. And so one of the things that came about as a result of our planning was the idea that if we can get a team together to treat the initial influx of patients, we get a team of nurses and a doctor. We called them the COVID doctor. I happen to be the first one. Then that person and that team can have the uttermost knowledge of what's going on as these influx of patients came to us. It worked out better than I could have ever expected, honestly. I didn't anticipate what happened to be the case, but we grew from one COVID doctor to 3 COVID doctors, and based on a number of patients. And it really brought unity and camaraderie amongst the nursing and all of the care team. So it was a great experience.
Dr. Heaton, I want to bring in Henry Molina. He is with Lafayette Federal Credit Union, and he's going to tell you why we really wanted to put you on TV today. Henry, tell the good doctor what you want to tell him.
Yeah, absolutely. Good morning. So, Dr. Heaton, on behalf of Lafayette Federal Credit Union, I really want to congratulate you for being recognized as this week's hometown hero. You've actually exceeded all expectations and answered the call of duty with extreme bravery, even when that meant risking your own health. You help protect your medical staff, your patients alike. But most of all, I think what's really important to point out is that you were a friend to those who most needed one. Your work at the hospital, in the health system, and in the community is truly inspiring and noteworthy. So to help celebrate you and to celebrate our 85th anniversary, we'll be sending you a gift card and a gift bag as a token of our appreciation. So thank you very much. Congratulations. And it's an honor to be on this call with you today.
Dr. Heaton,
I really appreciate that.
I'm going to give you the last word. What will you say to our viewers as we continue to battle COVID-19? It's not over yet.
First of all, that's a good point. I do have a mask with you. I'm in the room alone, so please wear your masks. But there are 2 thoughts I'd like to leave you with. One is you're welcome to the community, not only here in Manassas, but Prince William County and beyond. We're just incredibly impressed by how thankful people are in the community when they approach us, when they see us as patients in the hospital. That's been overwhelming to us. And secondly is thank you to the community, which is that we're doing the best we can. We're figuring things out on the fly as we go. And we're human beings like everybody else. And so trying to figure this virus out has been a challenging one, but we appreciate your support in this fight. Thank you.
Thank you, Dr. Heaton, and thank you, Henry. Always good to see you.